Africa is said to have a disease burden, but there is no capacity to manufacture medicines to meet the continent's needs. The health minister says spending on health is viewed as a social function and not an economic one. He says, however, that the economy of any country and the health of its population are inextricably bound, as the economy cannot be built with sick people. Motsoaledi says Africa is the only continent where, when a head of state is sick, they get treated on other continents, and this has to change.
If we are to be taken seriously that let's manufacture locally, let's also be treated locally to show the world that we have confidence in our own systems, and I'm demanding that.
Speakers say the future of Africa must be one where the continent manufactures its own medicines and tailor health solutions to its unique needs. Some say the answer could lie in the regional value chains and the Africa market.
Health expenditure is also externalized if we rely more on imports, right? So we spend money supporting jobs in other countries. It happens because we don't have capacity in certain areas, but also because of our buying decisions, all right? And how do we then increase aggregate demand, all right, to resolve some of the economic problems that we have in the country? So public procurement plays a role, local production, not only to support the public sector, but the private sector as well plays a role. The other issue that we'll have to look at is regional value chains that we can create the opportunities in Africa.
Donor aid cuts were at the center of discussions, with speakers alluding that this is also an opportunity for self-reliance for the continent.
We are seeing dramatic donor aid cuts at the moment. As Minister alluded, 2 decades of progress on HIV can be unraveled before our very eyes. DG Kasea put up a very telling slide in that regard. Okay. I'm prefacing those comments first because the penny needs to drop with the dire situation potentially we find ourselves in. Now, what stands between calamity and the second independence? The common element, the nexus, is our ability to set up and establish local manufacturing capability on the continent.
Delegates said that with the current shifts in the markets, the Africa Continental Free Trade Area offers a predictable market. Speakers said there is a need to prioritize operationalizing the AFCFTA to boost manufacturing on the continent, research and the use of local content, remove trade barriers and promote intra-Africa trade. Gloria Sefakomusi, SABC News, Johannesburg.